weekend, we learned so many new things that we did not know before. And of course, knowledge is power, like we've always said on the radio. We all have a gift in life, and our purpose is to give our gift away to someone else who can benefit from that, right? So, common ground is the human experience that all of us have to go through. Common ground is a human experience, right? We're all blessed. As we wake up each morning, we are blessed with so much to give, and that's what we have to do, is give to everybody, right? Be grateful for life, and we are going to improve our emotional, mental, physical, and spiritual awareness. That's what we're going to do. So we're going to be grateful, and we're all blessed. Indeed, we are blessed. When you look across the world, look at the news. Every day, especially over the weekend, what was the news? What were you hearing about COVID? What was happening across the other side of the world in India? Can you recollect? Can you reflect? It was absolutely mind-blowing, and it's a human experience which all of us have to be involved with, absolutely, because I have not seen scenes like that for a long, long time across this century. It was absolutely emotional, and you were shedding tears when you saw scenes like that. And this is what I have been talking about throughout the month, the human experience. COVID has brought along so many tragedies across the globe, everywhere that we go to, everywhere we see, in every country, we've seen different experiences. But what I saw over the weekend and the last 4 days, what I've been experiencing with COVID across the globe, especially in India, was not pleasing to the eye at all. So if any of you have not at all seen it, then I'm going to suggest that you catch up and have a look yourselves, and you will feel the same way I am feeling this morning. Is so much sadness to all our fellow human beings in India. I pray all of us here in the UK, we are praying for you, that you will come out of this horrendous period. This is maybe your second or your third wave, but it has been absolutely brutal. So all this, when you even see scenes like that, they affect your emotional, your mental, your physical, and your spiritual awareness is activated, of course. And I want all of you to say prayers for all the people in India who are suffering these atrocities. And of course, the sad thing is that across that region of the world, in India, neighboring country is Pakistan, it absolutely boggles the mind when one country has no vaccine, it doesn't produce a vaccine, and another country has no oxygen. Yet both of them saw it fit to do nuclear tests very recently. And this is absolutely absurd, where you need to sit these politicians down, pull their ears apart, and tell them what's going on. Are you asleep or are you awake? Now, only we, the public, can make a noise and make the world realize that in this pandemic, while we are experiencing these atrocities, why do we have to do that? And again, I'm going to reiterate that one country has no oxygen and another country has no vaccine. And you see it fit to go and do a nuclear test. What is happening to humanity? Who is going to make a noise with me? Let's do it together and bring awareness to the whole world that we must set our priorities right. When we cannot understand the value of human life, then we're all sad for it. What have we learned from the Spanish flu right up to today? 100 years later, what are we doing different? Of course, the UK, the USA, the EU, all these countries came together and they have been supporting the aid initiative you're talking about 1.2 to 1.4 billion people. That's the population of India. So aid that you send there is well appreciated, much needed. The point is not that this is not enough for the whole country, but the point is that your thought is there, that you are thinking about your fellow human beings and supporting them whichever way you can. So this is an absolute painful subject to talk about, to think about. Even I cannot express to you right now how I'm feeling about this. It's very hurtful indeed. So from all of us in the UK, across the globe, our prayers are with you. And that is how humanity should stand together to show what is the bond of humanity, right? Common ground is the human experience, and that is what we should all stand for. All of you listening out there right now, please share this sentiment with me, and let's all join our hands together and make a difference for a better world tomorrow. Now, what else we were doing this weekend? Of course, learning every day. Every day is a day of learning. We were learning so much about the institutional racism in our country. Systemic institutional racism in the country. Now, this is a subject that we are going to share with everybody throughout the country and see what we as a community, the wider community, can do about it to make a difference. I strongly believe that change lies in the hands of you and I. We can make that difference. I just don't believe that it can be done without everybody getting involved. Of course, air your feelings, air your thoughts. Let's put them on the table and let's talk about them, because these things ain't going to go away, and you sweep them under the carpet, or you choose to ignore them, or you sit by the fence and think that everything will change itself and I'm all right, Jack. It's not going to happen like that. It's never going to happen like that. And it's not about me or you as an individual. It's about change for the next 100 years. Whatever we do today will define us tomorrow. So we need to all come together on this subject. It's sad that we are each year talking about this again and again and again, yet we seem to be going over the same old. So this is a very deep subject. We had a lot of listeners calling in, asking us to do a specific program on this. And not one program, but a daily reminder that how are we going to make a difference? How are we going to bring about change? Many of you will have had experiences, you will have gone through this journey of having something happen to you in your job, in your work life, in your home life, or even out there on the street. So many stories that we come across here. Yet today we live in a WhatsApp generation, in the social media generation, where our concentration span does not exceed 7 days. So news comes and goes so fast. After 7 days, it becomes history. And that is the problem here, that we are not adapting as fast as we should with our humanity, our indifference to each other. That is what I want to talk about later on, but we will do a program on this. It's not as easy as just putting programs together. We're here for 30 days during the month of Ramadan, and when we get these requests, we have to start researching them, start putting a team together. A lot of learned people who have been active in this field many years, more than I have, and we have to connect with them, engage with them, and we have to create a structure of program. And of course, here at Radio Ramadan, we don't have the facilities or the resource to be able to do that in a jiffy, as they say, right? So we're going to put some programs together, and we're going to discuss them each morning. I think we'll start soonest tomorrow maybe. But today, I want to remind you all about our COVID conditions, our situation right now in the UK. I'm told that we have had about 27 million vaccines. First one or second one, I don't have that stat here in front of me right now, but do not think that you are out of the water. You have to still respect. You wash your hands. You start to put your mask on. Don't ignore not putting your mask on. You can see I'm not putting a mask on today because I'm by myself. And be very mindful. Keep your social distance. Put your mask on. Wash your hands and be absolutely careful. There's no guarantee. No one has a stat here in front of us. We are now amongst the Brazilian mutant. We have the South African mutant. We have variant or mutant. I don't know what is the right word to call that, but we'll find that out later when we have one of our experts come and join us and talk to us more about the COVID situation across the globe. And we have now the Indian variant, they call it. Now, the vaccine is not responsive to all of them because there are no tests conclusive enough to tell us that the vaccine is going to work on all these variants, the Brazilian variant, the South African variant, the Indian variant, and even the UK variant, right? We don't know. So much to learn about this. Sometimes all these studies can take up to 5 years before you know fully what the results are. And of course, I want to remind you all that during the weekend, a stat was discussed with me, which I'm researching right now, and it was astonishing that the number of medics from the ethnic community who had lost their lives in the very early days in the UK, the figure was in the 90s, 90%. That was the figure, number of people who lost their lives in the very early stages. So we started COVID conditions in March 2020, and now we are almost to the end of April 2020. Almost a year and 1 month has passed. And the number of medics that lost their lives from the BAME, a word that I don't enjoy using at all, from the community, the ethnic community, has been astonishing. From Indian doctors, Pakistani doctors, Sri Lankan doctors, Bangladeshi doctors, Nigerian doctors, and from the African subcontinent. And it was astonishing what a high number of them lost their lives in the very, very early days of COVID. Now, these figures are still being calculated right now across the country, in all countries in fact, that what is the reason why the ethnic community has been so much affected. It has been affected the most across the globe, and this is something that has to be studied in great detail. And later on in the program, perhaps we may touch on this with our expert who will join us after the break, and we want to go through that, discuss that, and find out what can we do now to bring about change. Solutions is what we are interested in, and we are going to discuss that. I got a message just now here saying that I read the Tony Seal report. Of course, those of you who don't know what that report's all about, it was the total report on the institutional racism, systemic racism in the UK. I suggest you all look that up on Google and get yourself familiar with that. It's like all other reports, it's many, many pages long, and I've not read a report anywhere today in my life where there is not controversy or argument or debate. And it's all about perception and perspective. People write these reports, they have a perception, and another person's, your perception, my perception is totally different. So this is what we all need to understand before we absolutely start going off the handle, right? And I think it's very important that we have to touch these subjects and deal with them. They don't go away. They're not going to go away. And we have to be fully aware what's going on. If we don't know, we'll be speaking about these matters without any qualification, which is not good at all. We need to have some knowledge about these things fully. So that's how we have to deal with them. So, of course, I shall be reaching out to all the experts. If you're an expert in the field of institutional racism, systemic racism across the board, then please connect with me. I want to talk to you, and we're going to hear your views from the sports arena to your work from the professional sector, how you're going to break down the professional sector. So if we leave sport to one side, then secondly, the professional sector will be your NHS, then all your government institutions, and thereafter then the professional sector is your accountancy industry and all the various different industries that we have. And then we can break them down and call in experts from each one of these sectors and have a open air debate, discussion with them that will enlighten us all. The purpose is awareness. That's what the purpose is. Bring awareness to everybody so that we can be part of the solution. Each one of us should take part in that field. So we can all become part of the solution and not continue to be perceived as a problem. When we sit outside on the fence, nothing's going to happen. So you can all take measures. You can write to your member of parliament. That's what he's there for. If you don't connect with him, you don't write to him, he's going to sit there and think everything is all right. Of course, he will only wake up or get his skates on, get his boots on, when he has 10, 20, 30, 40, 50 of his constituents going to contact him to tell him, hey, there's a problem here. We need to fix it. And you got to find those leaks and you got to fix them. You leave these leaks, the water will keep leaking out of that pipe and you're going to have a flood. That's what's going to happen, right? We have leaks everywhere and we need to fix the leaks. That's what we have to do. We have to do all that together. So if all of you are listening in, today's subject we've touched upon is COVID. We're not going to let go of this particular matter because it is absolutely prevalent and we need to keep reminding each other. Yesterday I myself I visited some friends and I was the only one masked up there, and they said, oh, you don't have to wear a mask. I said, no, you all have to wear a mask, otherwise I can't be in this environment. I says, you got to put your mask on, all of you. And I forcefully made them put their mask on. And nobody should become complacent and think, it's all right here because I know him, he's my friend, and I don't need a mask. And it's not like that. You could walk out the door and you could easily get infected. And that's as easy as it is. And I'm going to ask these questions to our expert today is, how easily can you get infected with COVID? How easy it is. And that's why we should not at all slip up and say that everything is all right. No, everything may seem all right, but everything is not all right. I've got another message here saying that it's so true, the issue about vaccines and oxygen. This is earlier on when I mentioned that one country is run out of oxygen, which is free out there. You can go out there and breathe. It's free of charge. But the oxygen they're referring to is in the hospitals where you need oxygen for the patients who are lying on that bed on their last breaths and they need oxygen. So hospitals, putting the vaccine aside, they don't have oxygen. And there are scrupulous people out there in India who are selling one bottle of oxygen for $500. This is the sad part of humanity, where people are looking to make a profit out of adversity. And this is very, very sad. You know, these are human lives and you are selling them. You're selling human lives at $500 a bottle. And of course, I saw on the news that a person actually, he told the story where he bought that bottle for $500 and that depleted, and then he didn't have any more funds to buy another bottle. And this is the sad part of exploitation, when you have people with 1.4 billion or 1.2 billion. I'd like my controller to check that and verify that. What is exactly the population of India? And he let us know, and I'm going to give you the exact figure. So it's very sad that we are abusing each other all over the world. When we do these acts, these are absolutely Very, very sad. The exact population in India is 1.366 billion. Now let's compare that with the population in the UK, which would be about 66 million, right? UK population is about that. So look at the disparity here. 66 million against 1.3 billion. How does a country control 1.3 billion? It is absolutely unbelievable. When you look at the USA population, it's about 328 million only. So India, the size of that country, is almost more than 10 times the size of the UK in population. USA, almost 4 times more people in India than there is in the USA. So these figures are astonishing. India is almost the same as China at 1.398 billion. These are the only two countries in the world which have passed the billion. The rest of the world is never going to reach those figures, right? Never. So you see, the UK is 66 million only. The UK is, yes? Of course, these figures, these stats are all available on your net. You can always look at that. The net is an endless library of knowledge for all of us, right? So always use it effectively. Don't waste the net playing games and doing useless things and Snapchatting and TikToking for useless things that are of no value to anybody out there. So use it effectively, and it's an endless library of knowledge. So today we're on to a very serious subject, and we're going to deal with that the best we can. So I'm going to touch base with you very soon after the break. Please don't go away. Join me straight after this break. You're listening to Ramadan Radio. Jazakallah khair. Join you soon. I hope you did not miss me too much. I'm back here for some more action with you. Today we're going to discuss some wonderful topics here. Today the topic we're continuing with throughout the month of Ramadan is COVID. COVID, COVID-19. Well, of course, right now it's COVID-20. So today I would like to welcome our guest from far away. You can try to guess yourself with the accent, is Dr. Saima Anis. Wonderful for you to join us this morning. Can you hear me?
Yes. Good morning and assalamu alaikum.
Walaikum salam. I hope you had a wonderful weekend and you are busy with your work and experiencing some of the pain and the emotion that we have all been experiencing here in the UK when we are watching the news with the plight of people in India. How is it over there, your side of the world? What are you seeing and experiencing over there?
We're experiencing more vaccine confidence, which means that people are getting a little bit more relaxed. And that can be a good thing, but that can also be a bad thing if you go too loose in your attitude towards the pandemic. But generally, in my state, numbers haven't been stable. They've been slowly creeping up. And we'd like to make sure that our hospitals aren't overburdened with serious cases. We'll talk more about where I am in the US later, but let's get down to your pressing questions, Zed.
Of course, when you mentioned about the vaccines, my first question to you would be, tell us more about the efficacy, right? This is, first of all, explain to us what is efficacy. Now, remember, I want to reach out to the people who don't know a lot of the medical words or terms. So let's start with that first. Keep it simple, keep it plain.
Completely simple. And this is why we keep touching on the topic almost every week, and we should continue to do so because we want everyone to understand how this works. So efficacy is a term that is used when you're trying to develop a vaccine, such as in clinical trials. And it's reserved for that process, this term. Effectiveness is the word to use for our use in the community. When you go and talk to someone, how effective is the vaccine? So if I talk about, say, I have 4 different vaccines in mind right now, which are very popular. We have the Pfizer vaccine, we have the Moderna vaccine, those two, then the separate category of vaccines. We have what is the J&J and the AstraZeneca vaccines. So efficacy or effectiveness is different for each of them. The Pfizer and the Moderna vaccines are 95% efficacy or efficacious. And the AstraZeneca and the Johnson & Johnson vaccines are about 66% efficacious. What does that mean for us in the community? What it means is the number of hospitalizations and deaths by these and serious illness by these vaccines is only possible in, say, for the 95% efficacious vaccines, only 5% cases, which means you are protected 95% of the time if you receive the vaccine, if you are exposed to COVID-19. However, what we've seen in real life, in real world, is it doesn't matter which vaccine you get, you are still protected from serious illness and hospitalization and death. The point being, get the vaccine.
Of course, now, one of the questions everybody will ask you when you're out on the street is, which one have you got? It's not a car, but people are concerned. They've read press about one and the other and the other and the other, and they're in total confusion. So what I want to ask you, going on further from that, is the situation in India is absolutely very been emotionally tiring to be even watching all that, because it has an effect on everybody's mental being when you see how is it being perceived in your neck of the woods.
Worldwide, not just my neck of the woods, Zed, we need to consider how the world is reacting to India's situation. So news media and outlets tend to glorify or cause panic. We need to clarify what that means for everybody. What this means is that in a country with 1.36 million cases, there are about almost 100,000 cases per day as of April 24th. That's a big number. And 100,000 people, so many people are dying. And the reason for that is that they have lack of oxygen at the hospitals. And oxygen is something that all COVID patients that are seriously ill and hospitalized need for their lungs to function. So the other point being, there's a lot of community transmission. And we'll come to that with your next question. So India is causing panic in that sense. The variants there are easily and highly contagious and transmissible. So person to person transmission is exceedingly high.
Of course, now we are on the other side of the world. How does this impact us? Because we were hit with the Wuhan virus and we were slow to react. All our people, our governments, they did not get their skates on till at least 3 months after. And as a result, where we are today, right? Now, smaller countries can effectively deal with the situation better. But larger countries like USA at 324 million people, UK 66 million, and then it's not about your population, but the way people live in these inner cities, the conditions that they live in, and how will it impact us, even though it's over the other side of the world, how will it impact us here in UK and in the rest of the world?
So here is what we're seeing. And at this point, I'm going to definitely preempt you with your next query, which is to talk about variants and mutations. So we need to understand very clearly what that means. What that means is a variant is the part of this virus that then becomes different from what it was originally. It started off as an A, the letter A variant, and then it progressed to the letter B. So what we're seeing is a propensity or abundance of the B kind of virus. Now, where is it coming from? The origins of the B virus are definitely European. The A virus, more like from Wuhan, Somalia, Uganda, coming to the UK. For the mutants, we're seeing A and B combined. So that's why the Indian virus has been called the double mutant. Now, that doesn't restrict it to being two kinds of mutations or two kinds of changes in the virus's genetic code. It means that it could possibly mean there's more going on in there. But for the sake of simplicity, to tell people how contagious is it, we use the term double variant. Now, how does that impact us? Not only does it impact us on a daily basis in our everyday living situation, or the way you describe how closely knit we are physically in our communities, because of square footage in the homes that we live, or the communities that are tightly knit together and they tend to socialize all the time, given that it's Ramadan, given that it's a call for prayer, maybe, given that we might be breaking our fast together. Contagiousness dictates that we stay apart as much as possible. It is not entirely possible for our people to stay apart, but we can take precaution, which is stay 6 feet apart, do the hand washing, wear your mask, and all of that. What does it mean for the rest of the world? That was your next question, Zed, right?
Yes.
What it means is travel is affected. You may not wish to have people who are traveling to you from different countries, specifically from the South Asian region, because there is high risk of those people bringing in the double variants. So if communities will not enforce that, airlines will be forced to enforce that. And we're seeing in the last 24 to 48 hours that our aviation industry is stopping flights from coming in. They gave us a sort of a precautionary ultimatum, and they said you'll have 24 hours. It's causing panic around. People in the US whose families are in India were scrambling to get their elders back in. People in the UK whose families, UK has had a travel ban of sorts for a while now. But I think what they're trying to do on a mass level right now is curtail travel as much as possible so that whoever is there should stay in place and quarantine in place and not move around and spread the variants.
Of course, right now, my concern is we seem to be going through the PRS again, right? The PRS, I don't know if you're aware of it, but we call it here problem, reaction, solution scenario again, right?
Right.
There's a problem, the powers that rule over us want to see the reaction, and then they come forward with the solution. And
Right. It's what we call disaster management.
yeah,
So before it reaches disastrous proportions, you need to intervene. And that's exactly what the governments are doing. So we're on the right track.
Of course, now what my concern is, and many people I've talked to have shared this concern with me, is the digital vaccine passport, right? Where this is a big point of contention for everybody because we have issues where airlines, the cruisers, and all the travel industry is looking to impose this either via the government or either by themselves.
Right.
Now, this here is going to end up creating 2 or 3 tiers or even 4 tiers of society. And we already have a fragmented society wherever we go, and this will just add to it. So there are many, many factors here to consider and to think about before these policies are made rule in each country.
I completely agree with you, Zed. I come from a digital health perspective because I'm a healthcare informaticist as well as a medical and population health physician. So I will tell you that digitization is not far into the future, the prospect of it. What will make this easy and uniform, perhaps, and if you want to talk futuristics in healthcare, is that we are able to catch their biometrics and then apply their vaccine status to the biometrics, which means you take a shot of their retina and do facial recognition, and then apply that to a digital passport, that information with their updated vaccine information. So I think that would be most useful, and it'll make it uniform, it'll make it simple, and it'll make it worthwhile.
It's almost a sci-fi situation here, isn't it? What we used to see on Star Trek in the 1970s, right? And it's almost coming to that scenario. We are not ready for that. I don't think so. People are worried about their identity, about their health data, who's going to harvest this data, and who's got access to it. And already we have here in the UK GDPR, and we are in the midst of division, we are in the midst of uncertainty, we are in the midst of fear.
But we're also in the midst of a lot of positivity. Think about with the GDPR and with what we call over here the HIPAA rules in the US, if we are able to implement such technologies, we are on the right track. And it is not to scare anybody off. It's not to steal their identity. It's for a good cause. And it's for disaster mitigation and management. And it's for people to feel more confident in the way they live their lives. Would you agree with that?
Of course, I'm all for digitization. I've been implementing it in my own sector. I think it's a wonderful way forward. And I'm always implementing the ATC, adapt to change. So every day we have to change for the better, and all the more knowledge that we have and the right kind of knowledge to feed to each other is what we have to do. I always say in my programs that we're all blessed with a gift, Dr. Saima. You are blessed with a gift, and it's for us to share that gift with the rest of humanity.
Absolutely. Anytime. We should do our best to share whatever knowledge we have, and instead of creating panic, trying to get people to understand the real issues at hand. And that's why we're here on Ramadan.fm.
Of course, now we're talking here also about children in our community. Children in our community, how safe are they? Because many parents have voiced concerns to me about this. And when will the vaccines be given to them? And what is the effect of the vaccine to these children?
I think everyone should know and feel confident that for the 12 to 15-year-olds, at least Pfizer is planning on rolling out something by the end of summer.
Of
So
course.
children in that category should, the parents of those kids should feel more confident come end of summer or fall. Younger children, younger than that, are still at risk. However, the numbers are not alarming in that age group. So they haven't quite focused their efforts on developing a vaccine in that age group. However, they're still not like completely free from the risk. So there are some children that get outbreaks, but infections in children and the way the disease has been running its course, you have noticed in your communities that they're sort of milder and they do seem to recover. In very rare instances where a child is immune compromised, meaning their immunity is weak, you might see serious illness, or you might see the long COVID, which is the long haul effects of COVID, which is what we as physicians called a multi-system inflammatory condition. And it's no different than having a long-term effect of a flu. All manageable unless you see signs of breathing issues, in which case you take the child to the hospital and they treat them there. So point being, children up to 12 years, for right now, we're okay with 12 to 15. We might see vaccine rollout by the end of summer or fall, depends on how Pfizer and other pharmaceuticals pick up. I know there are current trials going on, at least in my city and Seattle and other cities, through the biggest children's hospitals. The effect of this will be downstream and should be received very well in UK and other countries.
Of course, yesterday, still, I'm being asked by friends and people that I know. One person told me yesterday, it was quite alarming. He says, "No, I'm not taking the vaccine." I said, "Why not?" He said, "I'm going to wait 5 years to see what has happened. It will take 5 years before the effects of the vaccines are out in the open, and then I'm going to take one." And this is still the perception that people are following, that wait and see what happens a year, but 5 years to wait is quite mind-boggling, isn't it?
It is. I would say that the pandemic will burn itself out. From some of the collective evidence I've received from online media and resources, should burn out by the end of 2023. Or the hype and the whole hullabaloo about how we're leading our lives, there should be some normalization beyond 2023. So it's not 5 years in, it should be much sooner, because that's a natural course of any pandemic. We've seen with the Spanish flu and the others 100 years ago. So
Of course.
there is hope, and that's the note I want to leave you at. And the other thing that I would leave you at is prevention. Vaccine is a tertiary form of prevention. There is hesitance, as always. Some people, you can't change ideas and beliefs overnight, but it's only a matter of time when people will see sooner than later, sooner than 5 years, that the effects.
Of course, we're sorry to interrupt you. We're coming to the end of the program, and it's just gone very, very fast, because we are talking with a lot of naseeha, as they say, and pandemic burnout is amongst us all. So, Dr. Saima, I will request you kindly to do a closure here today. We have 20 seconds.
Keep mentally and physically resilient. Don't succumb to burnout. Keep your prevention practices in place. Mask up. Socially and physically distanced at 6 feet, not 3 feet. The variant is more contagious, especially in countries where our listeners are located right now.
Thank you very much, Dr. Saima. Much appreciated. Mask up from Radio Ramadan. Jazakallah khair.
Bye.